What's distressing as we go around, and it's probably not the case among a group that's here, because you're certainly the more proactive members of our profession, but so many doctors and their teams have no idea of what's going on in their practice. The metrics that are involved to understand the business side of what is truly a business is foreign to them. They don't know the basics of what's important. Maybe they do around this time of year because it's tax season and they probably have just recently met with their accountant. But in general, they're oblivious. Of course, the usual things and the most aware things that we would have would be production, collection, accounts receivable, number of new patients, getting a little more esoteric, the overhead percentage, break-even point. Some statistics that we like to use when we're guiding a practice is the production per hour, because it's a lot easier to conceptualize something on a per hour basis than it is on a yearly basis, and also the extent of the third-party financing. We find that practices that are engaged with third-party financing from companies like Care Credit, generally if they're around 20%, they're being extremely productive. They show their best months when they are showing up to 35 or even 40% from third-party financing. It's also important to understand the trending within a practice. And when you look at a graph of a practice like the one on the screen now, it's easy to see the peaks and the valleys and to find excuses for the valleys. There were vacations, there was bad weather, there was sickness, there was a catastrophic event, and that's why our practice didn't do so well that month. But more important when we're looking at this type of a graph is looking at what's going on in the peaks. Because what the peaks show is what is the potential for the practice. What's concerning when you look at a graph like this is not what they were reaching in their peaks, but the fact that the peaks were not able to be reproduced in any sort of a consistent way. And what that indicates is that there's probably some sort of either a system breakdown or a failure of the systems, or maybe no systems at all. So that when you start to get busier and start to become more productive, the systems that you do have in place are inadequate to make it possible for you to accomplish that in an efficient and stressful way. So when you start to see a graph occurring like this, what you need to do is start to reevaluate your systems and understand what it is that contributed to the busyness and what is it that we were not able to keep doing as we went on to the following month and the month after that.
So it has been a challenging economy. It's still a challenging economy, and there are some myths. There are things that we've encountered practices doing over the last few years that are kind of frightening to us. Things like drastically trying to control expenses, trying to cut overhead in half, treatment planning less aggressively because suddenly doctors and team think that patients just don't want to hear it anymore. They don't have any money to spend, so we're not going to tell people what we really see. We're just going to sugarcoat everything until things get better. They have eliminated all of their external marketing. They're not spending any money on the things that they were doing before that they knew they were getting some result from. We've encountered a lot of practices, particularly in the Northeast, that had no level of insurance participation, that joined all kinds of PPOs, and that was a big mistake for them because they had a lot of patients in their practice that were on those PPOs, so now they've had to slash their fees in half for patients that they already had, and then they got a handful of new patients, so that didn't work. So this is all management by fear and worry, and hopefully you guys haven't had to resort to those types of strategies, but what we would like for you to focus on is increasing your productivity rather than focusing on things that aren't going to give you a good result. This is a great slide that Steve's going to do right now.
And this slide talks about the difference between trying to cut your overhead or trying to increase production. And this happens to be a very good practice. It's a $600,000 production with dental supply costs right on target at 6%, and that would take it at about $36,000 for the year. If the doctor turns to his highest paid team member and says, I want you to start cutting the costs of some of our dental supplies by 10%. So now you have somebody that's forced to go from catalog to catalog trying to save 50 cents on cotton rolls. And the amount of effort it takes to try to do this on every single item in the inventory is tremendous. And what do you end up achieving by this tremendous effort? Well, if you save 10% on your supplies, that means now your supply cost is 5.4%, and that results in a big savings of $3,600. I can tell you emphatically that it does not take more effort than it did for that team member to save the $3,600 than it does for the practice in general to try to boost production by 5%. And on a $600,000 practice, if you're able to boost production by 5%, it results in increased revenue to the practice of $30,000. Which would you rather have? $30,000 additional revenue or $3,600 in savings? It's a no-brainer. I want you to put a circle around this slide in your workbook because it probably is the most important slide in our presentation. And it shows the importance of understanding on a per-hour basis how it is easier to make huge changes and huge benefits for your practice. And this happens to be a very good practice that we've used as the example. The doctor is producing $500 an hour, works a 32-hour work week, there's a 40-hour weeks of the year, and the hygienist is producing $150 an hour. Certainly a very solid practice. If you take a practice like this, and I'm going to preface this by saying, I am not saying doing dentistry that is not needed and required and is appropriate. I'm saying that if you start to look at your patients differently in the way that you treatment schedule and treatment plan and diagnose, this is easily achievable. If you add one additional resin a day for the doctor with these parameters, conservative fee of $200, it results in a $25 an hour increase over the course of that day. So that if you could do one additional resin in concurrence with another procedure, an adjacent tooth, an opposing tooth, the tooth next to it has some improper anatomy that may affect the contact. If you can do this, it will help you achieve a $40,000 increase in production over the course of the year. If you were to do one additional crown a day, or onlay, or inlay, and I strongly recommend using inlays and onlays for some of the class 2 restorations posteriorly, especially with the abilities to do CEREC and E4D and do one-day dentistry, then if you do one additional one of these procedures a day with a moderate fee of $1,000, that results in a $125 an hour increase over the course of the day. And if you could repeat that for the days throughout the year, it would add $200,000 production to a practice. It's a lot easier thinking of it this way than it is saying, I want you to increase your practice's production by $200,000. And the same works for you hygienists, that if you do one additional sealant a day, or one additional periapical day, or one additional fluoride treatment, or desensitization procedure, then over the course of a year, that generates an additional $8,000. If you do one additional root planing a day, by understanding that if the patient has subgingival calculus, if they have isolated 5mm pockets, that it is no longer a prophy appointment, but it is a periodontal treatment appointment, then you can add $30,000 to the hygiene production over the course of the year. So start to think of this slide as a guide on how you can start to pump up the production of your practices. There are 3 ways to increase production. One is to increase the number of patients you treat. One is to increase the revenue generated by doing more procedures. And the other is to increase the charges that you have and the fees you charge for procedures. And it's easy to look at the numbers of a practice and give guidance when each of these things is appropriate. There's work involved in all 3.